further explore opportunities on where we could further reduce stigma and discrimination. We are joined by other members here on the stage. I'll introduce them first. Jack Rapatara Fair-Bunruang. He is a research physician affiliated with IHRI, or the Institute of HIV and Research and Innovation in Thailand, whose field of study includes HIV and STI prevention, screening and treatment, sexual health, along with gender-affirming hormonal therapy for transgender population. Welcome, Dr. Fair. The next one is Vanessa Monley. Vanessa is the program officer at Youth Lead, Asia Pacific's largest network of young key populations, and she currently manages the United Nations partnerships for the organization and international funding to sustain young key population networks in the region during and after COVID-19. And she has also been involved in several publications and research on mental health and organizational strengthening for young people and young key populations. Welcome, Vanessa. And I am sure most of you know her already, but I'll introduce her anyway. She is best known to being crowned as Miss Universe back in 2019. And Catriona is more than just a gorgeous international beauty queen with the iconic walk that has captured the world's attention. She is also a passionate advocate and ambassador for noble causes such as HIV awareness, the Filipino arts, and cleft care. She has also become a highly sought-after host, speaker, and endorser both in the Philippines and internationally. Welcome, Catriona Gray. So let's start our conversation. I hope we could be as relaxed in this conversation as possible. If you have any questions, especially with the presentation earlier, you can key in your questions and we'll have an opportunity later to ask questions live, or for those who are keying virtually, you can also ask your questions online. But let's start first with Vanessa. We know that in terms of accessing HIV-related services to the youth sometimes is a really great challenge. And what are some of the key barriers for young people accessing critical sexual and reproductive health and rights services and HIV-related services? And what needs to be changed so that, and also what can the youth do to help this change?
Hi. So first, I really want to touch on that for young people, it's not a homogenous group. It's very important to touch that, especially in the HIV response, we need to look at young people in all of their diversity, especially as young key populations. And I know you touched on key populations throughout the past 2 days. But just to remind you, that young cohort focuses on young transgender people, young people who use drugs, young men who have sex with men, young people living with HIV and their partners as well. Sorry, I'm a bit nervous because I'm sitting. I'm like not even nervous about you guys. I'm literally nervous. Sorry. But anyways, so Youth Lead, we're the largest regional network on young key populations, and we're part of the interagency task team on young key populations, one of the strongest coordinating mechanisms between the UN and also regional YKP-led networks. We came out with a report on YKP data last year, and that was presented at the International AIDS Conference. And this is actually a pretty big deal for us because we really lack evidence and data on young key populations. So with this report, I think it's based on 2020 data. It came out with, among new infections, 26% young people accounted for. Of that statistic, 99% are young key populations and their partners. 3/4 of that statistic are young men who have sex with men, but they are the smallest cohort that are actually accessing critical HIV and SRHR services, which is super concerning. Given that context, Youth Lead designed a regional sensitization training program for healthcare workers. And it's in its piloting stage at the moment. It should be completed around next month. And we piloted this in Papua New Guinea, Indonesia, the Philippines, and Cambodia. Actually, there's some implementing partners in this room right now. Yeah, so it's a 2-day training program, completely led by young people in Yankee populations, which is the most significant component of this training program, that Yankee populations are very, very much well suited to take control of the HIV response concerning their well-being. So it's a 2-day program. The first day focuses on data. So in the regional context and also the national context, it focuses on risky behaviors of Yankee populations and also HIV prevention packages. The second day focuses on mainly mental health, because when we did consultations in designing this program, we found that critical missing components for youth-friendly services was mental health and also SOGI. So yeah, the second day focuses on that and also focuses on emergency situations. I would like to say the Asia Pacific, but this is a global thing. When we go through political emergencies, natural disasters, and most recently a global pandemic, Yankee populations are the most disproportionately affected by HIV. And in the global pandemic, this was exaggerated. And so this is one of the key factors in why we designed this program, to make sure that young people do not get left behind again. That's how Yankee populations are leading the change. Yeah, was that all the questions?
Well, for now, but thank you for sharing all of those initiatives, and I hope that it will really replicate to, especially how we convince or have Yankee populations really have in the center of the response as well, because we know that's really, really important. I'll go first to Dr. Fair, and we know that some of the biggest challenges of enacted or perceived stigma that the communities face is actually from healthcare providers, and especially healthcare providers that are not sensitized to sexual health and or HIV. Have you found any stigma-reducing interventions that have been particularly successful in addressing healthcare provider-related stigma, or you can share your own experience on how do we really address this problem?
All right. Good morning, everybody. Please excuse my nasal voice. I have checked. It's not COVID-19 infections. It's just allergic rhinitis, which seems to be harder to treat these days than COVID-19 already. Okay, let's get going to the answers, right? And it's true. I think healthcare professionals, especially the physicians, they carry a lot of stigmatized attitude towards HIV and other gender insensitivity as well. I need to address first the problems in 2 levels, let's say. The first one is the systemic problem, right? I don't think that we advocate enough for the medical education system to be sensitized in terms of gender sensitivity and HIV stigma and discriminations. I graduated 4 years ago. It was in around 2018, and that was 3 years already after the launch of U Equal Use campaign. I've never been taught about that in medical schools. Sorry, professors. But it's true. I only know about its existence, but I don't know how to implement it well. I don't know what it means for people to understand what U equals U means. And that's the starting point already for the stigma and discrimination in people living with HIV and people living without HIV as well. So what I would suggest is that as healthcare professionals, some of us are sitting in the higher positions, we can also advocate for that in medical education system, have a course about gender sensitivity available for all the medical students in Asia Pacific region, in order that they know what we are, what is the diversity, and what is HIV is and means in today's modern days, right? Because it has been changed a lot throughout the years. So that's the first thing. The second one is that we need to have an efforts to advocate for a systemic change as well in terms of eradicating stigma and discrimination. Earlier in today's talk, I have listened to Dr. Tuvisap talk about how we are pushing stigma and discrimination eradication into the hospital accreditation system in Thailand. And I was so thrilled to hear that, because formerly I have been studying about the HA process in Thailand and have seen that there's a lot of things to be covered in that HA program, but never stigma and discrimination. None of that was in there before. So once it has been listed officially in the process, then the KPI will start to roll out, right? So the nurses, healthcare professionals, doctors, they know what to do systemically to have this kind of evaluation for them. And that is one of the ways that we can push forward in terms of eradicating stigma and discrimination in a wide systemic space, right? But that's a very big thing. What we can do about that is to advocate for that, because I'm, especially me, not in a place where I can be loud about this, because I work in a very bottom field, not exactly a policymakers, but I'm voicing now, so that's what I'm doing. So that's what you can do as healthcare professionals to monitor your own system, to make sure that you are not advocating for stigma and discriminations. But what else can you do in terms of being a clinicians and people who giving care to the clients? What I have learned recently, actually, I'm not embarrassed to say, is that I'm spending more time with people living with HIV and non living with HIV. And I ask them more questions regarding stigma and discriminations. It started recently, around 3 or 4 months ago. I start to ask more questions about their well-being when they are in for their refills for the pills, for their monthly checkup. I ask them one question about their sex life. It's the start. I ask them, are you enjoying your sexual health or sexual life? And the answer flows out of them. It's like breaking the dam. They have this conversation in themselves. They have this contradictory information in themselves already that they do not know how to express. And I'm so glad to be the one who break that dam. And I've surprisingly found out that around 60 to 70% of the clients I have given provided the service to, they do not have sexual life anymore. Especially people living with HIV, they do not dare to have sex anymore, which is so sad, right? Because we have known that U equals use, they means more than just the letter. It means that they can enjoy themselves. It means that they can build relationship based on that. So to emphasize on that is very powerful for them, the clients, to be assured by people in this field that this is true, that this is, it's like putting the stamps on their attitudes. And even though I know this panel is about influencers, I'm not that. I'm more like an influencer, not influencers. However, as a clinician, I meet with the clients around 30 to 40 people per day, and I work 6 days a week. I know I work a lot. So around 200 people that I meet per week. So that's a lot already. In a way, I am an influencer already, right? Because I get to be in this intimate space with them and to talk about things that they cannot talk about with anybody else. So all of you here, if you are a clinician and still providing care, you are the influencers. You meet a lot of people, let me assure you that, and you can spend one question to address this kind of stigma and discriminations on your part, and you will find out that there's a lot to unpack there. And I would just give an example only in people living with HIV, but what about people coming in for STI testing and they do not know about PrEP at all, or those who are afraid of taking PrEP because they are afraid of carrying them, because they sounds, right? The pills, the bottles, when they move a lot, it gives a sound. And sometimes that itself is the stigma already. So you need to address that in your care, and I think it is the start of something. Right, and what I would leave here in a final note is that we need to address more about the workload here that we are all carrying. I know, we are working a lot. We know that already, to eradicate all those things. But Thai Public Health Minister, Minister of Public Health has just mentioned that we are now facing physician scarcity in the system in Thailand. And we are, the ratio for the physician to the patients is around 1 per almost 2,000 in Thailand. That's a lot. And when you have to face with such workload, you have to sacrifice something, and that's being the quality of life for your patients, because you are so focused on the survival, right? I truly understand that, and this needs to be addressed in order that we can move forward for the solutions. However, it's only one question away from addressing stigma. So I think you can go back to your home countries after these panels and just start doing it.
Thank you so much, Dr. Fair, Thank you so much for highlighting the importance that even in our field of work, in our line of work, we have our circle of influence. And speaking of a person with a huge influence, Kat, as a person, or a person with huge influence, or as would say, a celebrity, can you share with us how you have come to work in this advocacy, and how are you leveraging this status in undertaking your past and your future advocacy work around stigma?
Hi, everyone. Thanks, Mama Danvik. How I came to this advocacy, I wish it was a nice story of that. I empathize with the plight that people were facing within this. But unfortunately, it was in losing a friend. It's not the greatest introduction, but an introduction nonetheless. I've been working with this advocacy for 6 years alongside Love Yourself in the Philippines. It has also opened up my eyes to not only the plight of those suffering from the illness itself or the virus itself, but also the stigma that goes hand in hand with it. And in the last how many years, we've made incredible advancements in the medical field and research field, but the stigma is just seeming to improve just a little. And when we talk with about a person with influence, as I love that was pointed out, we're all influencers in our own right. Please take that home. But as a person with influence, it's almost a tricky thing to balance an advocacy on, because in a way, I don't really have the authority to speak in a medical light or in the background of research. I am from neither of those backgrounds. But my work in lending my voice to this advocacy is simply using my platform as an amplifier and working alongside community-based organizations or those in the medical field to amplify the message that they have. Because I really feel stigma is a multi-intersectional problem that we really have. And in a way, when you think of it in the lens of social media, we all are quite judgmental. And the scary part with that is that social media, something accessible from the privacy of your home, goes on a public forum board that's accessible to everyone. And sometimes in the name of transparency, one loses their right to privacy and safety. So kind of expecting individuals to come out publicly, either with their status or their work in the advocacy, or maybe even calling out public government for something that they could do better in terms of the advocacy, becomes a little bit of a scary thing. So what I'm able to do with my platform, as are many people with this influence online, is that we simply lend our platforms and our own voices to amplify those calls out for help or improvement or for betterment. Funnily enough, though, the parts within this advocacy that have touched my heart the most is after lending my platform, which I continuously do, is when I'm pulled to the side, which is off stage, or I'm going about my day and someone approaches me and says, they could be a person living with HIV, and they said, you made a space feel safe for me, or you allowed me to have access to a community that cares for me, or I learned about this resource because of what you were able to broadcast on your platforms. And even though you won't see those type of stories in the comment section, because it's a very public thing, you will experience it in the private spaces, the ways that we have been able to impact and change lives in these small ways. But when you multiply that, it's really a ripple effect. But in terms of maybe going outside the sphere of social media, what we also could do is, as my fellow panelists have also touched on, is whenever you see or witness discrimination in the workplace, maybe even in your own homes. Maybe you've seen the way that someone has talked to someone near you. You can quietly pull them aside and try to give them a little bit of maybe advice or educate them, or just to tell them there's a nicer way to say something, or maybe don't say it at all. Because we need to emphasize that the H in HIV in a way of being, it's human. We need to see the human behind the statistic, behind the condition, because these are people's lives that are being affected, and absolutely no one should have their life, their potential, their opportunities, their health limited because of a manageable health condition. Yeah.
Thank you. Thank you so much, Kat, for those wonderful words. I agree that, as a person with a huge influence, I think it's helpful that you are an amplifier of all the causes that we are bringing. Because, of course, even if we as medical professionals, community-based organizations do our work, if we don't have those amplifiers, it will not go out there. So thank you for your work. Let's go with Fong. Speaking of conversations, and these conversations are already going in social media, but aside from creating awareness campaigns to deliver messages revolving in the reduction of stigma, what can communities, organized communities like your organization or non-organized communities, what can communities do to ensure that the conversation about the reduction of stigma keeps going?
Okay, I think, to be honest, I think this is a really interesting and really a helpful question. And it's also a very hard question to be really addressed, because to get a really effective communication effectiveness, you need a consistent enough, you need to execute the consistency enough for your communication campaign, which means that you could not just create a campaign that's lasting for 3 or 6 months, but you need to create it year by years. And this is one of the challenge that the community are facing, especially to the minor organization, because the lack of financial and resources that we could not have the ability, such as the big brand. The big brand had their own budgets, right? And they create the communication branding campaign years by years, and that helped to secure the image of their company in the mind of the customer. But for the social organization, we don't have that much resources. So we need to think about a more sustainable way to boost our communication, social discussion, or in the a technical term for that is the social buzz. So I've been thinking about this, and I think that there might be 3 methods to help sustain the conversation after the execution of our campaign. The first one is the one that we have got, that is to create a annual occasion to help the people, to remind the people that in this occasion we got this. And for HIV, we have had the 1st of December as the day of recognizing the HIV prevention and control. And the second one, I think, is that there is a tactic in communication that called PR stunt, public relations stunt. So there is a very interesting example of public relations stunt just recently in Vietnam. So there is a case of a president of a very well-known bank in Vietnam, and on the celebration of 30 years of establishment and work establishment of the bank, he decided to organize a dancing show. He decided to dancing on his own with a very youthful image, with a very sexy image. And the interesting things about this president, he's a president of a very big bank, but he's still he's still alone. He's still single, and he's still, although that he has reached the age of 45, but he's still so very youthful and sexy. So that the way that this president create a dancing show by his own gained a lot of the attention from the white public, and the Vietnamese social media landscape recently talked a lot about him. So that one of the example about PR stunt. So in our case, I think that we could create something like that. To be honest, I have not yet have a really concrete idea about creating that, but I think PR stunt could be used for us as a tactic to boost the social discussion about the problem, about the community. And the final one that would rely on the communication asset that we create during our campaign. For example, in the case of the You Equal You campaign in Vietnam, we have created a lot of, let's say, communication material like the handbook or infographic, and it could be used to widely distribute. We also create the artistic work from the artists, and we also create the MV, and those are things that could be reproduced and used time by time, that no need a special effort or no need a really resourceful resources to be invested. Like, for example, I think in this year, maybe we can think about reorganize the exhibition of Heartbreaking Again, or we shall create a, the series of articles that talk about the meaning of those artistic production. And we could create some event to distribute the material that we already have. So that what helped us to remind the message of our campaign to the wide target audience and reduce the cost that we have to pay for that. So these are free method I think could be adapted to help us maintain the social discussion about our message.
Thank you so much, Phong. And I hope thank you for your work, and I hope this work can also be done by other organized communities and community-based organizations in the region. I think this is, we have a few minutes to entertain questions from the audience. If you have any questions, feel free to raise your hand, but as you create your questions, there is a question online, and I want to ask it to Dr. Fair. The question is, don't you think by normalizing HIV, just like cancer, hypertension, heart diseases, and such, can decrease fear towards people living with HIV and HIV itself, and make not only key populations, but the general population to be more open to go for testing?
Of course. Thank you for that question. It is truly, it's true. I think the normalization of HIV infection would help a lot with the stigma and discrimination. I have personally tried to do that myself in my medical years. I have published this poster actually for a campaign in mother-to-child transmission of HIV, and I created quite a controversial poster back then because the poster itself is the portrait of a child drawings with her and her mother, and the bubble saying that my mother gave me everything except HIV. Because that's the message that I want to get across, that HIV is a chronic disease. I lost. Only because the author's poster are better, of course. However, I think this continuous effort to try to normalize HIV infections would help a lot with not only people who are not infected, but also people who are living with HIV in order that they can know that they can become once they were, like before the infection, and they are still the same person. Yes, so HIV equals chronic disease, definitely something that I would advocate for.
Thank you for that answer. There is another question from online, and this is actually not more of a question, but I think they would want to know your thoughts, and anyone in the panel can answer this. As a person living with HIV, I do think using the phrase "not a death sentence" is both negative and outdated. There are other ways to talk to newly diagnosed, such as there is life beyond diagnosis. Do you have any thoughts with that sentence? Anyone from the panel?
I just think it really highlights the emphasis that we need to continually keep on putting on the language that we use to address people living with HIV and just around the whole topic in general, because again, words are so powerful. It's our main tool of communication, and sometimes imagine it could be right after someone's diagnosis and those first words can be so impactful, or the words that they receive from a medical professional, from their peers, from their family can really dictate the severity of either their internalized stigma or how they will perceive the world around them as they navigate the path forward. So, of course, like everything, our language is ever changing. It really is. And there needs to be that conscious effort to continue to update ourselves or to be sensitive. And it can be in a conversation. If you're on the receiving end and you feel offended, perhaps it's the effort to just educate the person and say, well, I understand where you're coming from, but these are the words that possibly we could utilize. Or if you're on the giving end, just ask, how can I better phrase this? Was this okay the way I said it? Because we're not all expected to know everything and be perfect. It's very much like the discussions that happen around mental health. It's just knowing the right words to use, but it's a learning process going forward also. So thank you to the person who submitted the question.
Thank you so much. Again, thank you to all the panelists for sharing all of your thoughts and your insights. This has been a wonderful session sharing how can we really explore in our line of influence, how can we really eradicate stigma. Thank you very much for your contribution. A warm round of applause for everyone. Thank you. Yeah. And as I call my co-chairs to go on stage for some closing remarks, I guess I'll start with my closing words. We would like to thank you all for attending this meeting, especially in our line of work in providing care, not only for people living with HIV, but for everyone who are affected by HIV. I think this is a very, very important meeting to make us ground ourselves and realize that stigma is a huge player on how it influences our community to access services, to continue accessing services. And I think you have learned so much, and you have these learnings to bring home to your facilities, to your organizations, or to your circle of influence into your own respective countries. Thank you so much for attending today.
Yeah, so just to add a little bit to Danvik, I think like this last session is so wonderful, and we hear so many powerful words and powerful campaigns. So thank you so much for the panelists here. And I also believe that like we have had this Asian Stigma Discrimination Forum for a few years now. 5 years now. And I think like as the chairs here, ourselves has progressed internally as well, being the one who like designed the program and everything. And I so do believe that you as the audience of this forum, if you have attended the forum the many years before, you will also see that the evolution of stigma and discrimination has been quite dramatic, at least for me. I mean, we have moved forward, from being just talking about stigma discrimination related to HIV as a virus, right? And we know that that's not efficient at all. We really need to think about this as a people-centered thing, in which I believe that talking about intersectional stigma today, learning about the drivers of the stigma discrimination, as well as the levels that you can tackle on, as Dr. Fair and Katrina said very beautifully, everyone can be an influencer on his or her own rights. That's really our roles beyond our occupations now. To do anything that you can in any setting that you have the possibility to do so. Tell people softly, but sometimes you need to be harsh, no? That this is not the way that you are treating other people. You have a better way to do this. So do this repeatedly. Remind everyone, remind ourselves every day, and then reproduce new actions. I think that's the way that we are going to do this and eliminate discrimination altogether. Thank you very much, and hope to see you again next year as well.
So I'm not going to say anything but to thank you too, because you've organised what I think is a fantastic meeting, and it gets better year after year. I'm struck by what you've done in the region, really, and I feel slightly embarrassed that we're lagging so far behind in Europe. And I think, in the old days, it was the Europeans and the Americans. I think it's time for you to come to Europe and America and show us what can be achieved. I think clearly there's work to be done. We saw some great country programs, but there are still people who are stigmatizing. But I think they will be gone soon. That's the my age, surgeons, kind of thing, but they're going to go. And I think what struck me is that we've got a load of young people on the panel, and the difference that you can make, and moving forward, the difference that you will make. And I think all of you should be really, really proud of yourselves. That's my take-home message, because I think you're all fantastic. I think VIVE are fantastic. They sponsor the meeting, are endorsers, etc. Please fill out your feedback forms, etc., etc., etc. Thank you very much for coming. Enjoy your lunch, and you deserve it.